March is Deep Vein Thrombosis Month, which is why we are joined by Dr. Jason Gilster of Inovia Vein Specialty Center. Dr. Gilster, thank you so much for joining us.
Thank you.
Let's start off with what exactly is deep vein thrombosis, or DVT?
Yes, DVTs are when people form clots or thrombosis in the large veins of the leg and will develop symptoms related to that.
Just how common is DVT?
But we think that DVTs occur in the United States at around about 1 million people.
What are the signs or symptoms people should look for?
Well, the typical classic signs and symptoms are the sudden onset of swelling and pain in the leg or sometimes the arm.
What are the risks of DVT?
The risks of DVT are generally related to other conditions that the patients have. The most common are things like after surgery, or some patients that have developed other cancers will develop a higher rate of DVT than the general population.
And how do you go about diagnosing and treating DVT?
Well, if you do suspect a DVT, you certainly should reach out to your provider, and with an exam, sometimes this can be diagnosed by seeing a swollen leg. But typically, the most accurate way to diagnose it is the use of something called an ultrasound, which we're able to use to see the veins of the leg.
And tell me about the treatment process. How long does it take?
Treatment of DVTs is typically with the use of something called anticoagulation or blood thinners. And typically patients will be treated for around 3 to 6 months on those drugs.
DVT is not the only thing you treat at Inovia. Can you tell us about some of the other things you offer?
Yes, we also treat conditions of what are called the superficial veins, or the veins just under the skin. Those veins will develop conditions such as swelling of the leg, varicose veins, skin discoloration, or even leg ulcers. And we have some office-based treatments that will help treat these conditions.
Dr. Gilster, thank you so much. I learned a lot.
You're welcome.
To learn more about Inovia Vein's 5 Oregon locations, visit inoviavein.com or call 1-800-VEIN-DOC.